My name is Chance Gray, and I am a hip and knee replacement specialist at Florida Orthopaedic Institute. Most of the patients that I take care of are patients that have problems with their hip and knee, usually related to arthritis, but oftentimes can be younger patients as well, or patients who have had issues with a prior hip or knee replacement. The most common things I see are people who have had worsening pain in their hip or knee, usually with activity. For instance, they may have noticed that they can no longer walk as easily on the beach or on the golf course or around town. Some of my patients have issues where they'd like to be able to play with grandkids or get back to other sports as well. So the way I approach each patient is assuming that they're trying to avoid surgery, first of all, and second of all, that I would like to be able to get them back to doing whatever they were doing before. Often they assume that they're never going to be able to do some of these things again that they used to be able to do. I like to try and reassure them that in most cases I can get them back to doing a lot of those things. What I like best about what I do is the opportunity to get people back to doing things they love. When I see somebody after a successful hip or knee replacement and see the joy that they've been able to experience just resuming activities, it's my favorite part of every day. The reason I love being a part of Florida Orthopaedic Institute is I think we have the best team to take care of patients that's in the whole area. I found that we are extraordinarily patient-centered, and also we really believe in empowering people and empowering our teammates. And I think that's a unique approach to the practice of medicine in this area.